In this video, the ultrasound assessment of the supraclavicular lymph nodes is shown. The patient lies in supine position, with the neck hyperextended and turned to the contralateral side. The region of interest is demarcated. The probe is first placed in the transverse plane on the superior border of the clavicle and swept from caudal to cranial along the sternocleidomastoid muscle. The same movement is repeated on the trapezius muscle. This video will show the ultrasound assessment of the left supraclavicular fossa. The probe is first placed in the transverse view to locate the left lateral lobe of the thyroid gland. In order to evaluate these lymph nodes, the supraclavicular fossa should be identified, delineated by the omohyoid, sternocleidomastoid, and trapezius muscles. Please note that the omohyoid muscle inserts at the hyoid bone lateral to the insertion of the sternohyoid muscle. The omohyoid muscle is identified along with the sternocleidomastoid muscle, shown laterally with its two heads, the clavicular and sternal. The trapezius muscle is identified more laterally. The same boundaries can be identified in the longitudinal view, starting from the thyroid gland and moving the probe caudally and laterally in a fan-shaped movement until reaching the trapezius muscle. Moving the probe cranially again, the omohyoid muscle insertion can be traced. Returning to the transverse plane and moving the probe medially to the sternal end of the clavicle, the venous angle, or the confluence between the internal jugular vein and subclavian vein, is seen. The thoracic duct usually ends at the venous angle in close proximity of Vercoe's node, which is often involved in advanced abdominal pelvic malignancies. Finally, the branches of the subclavian artery can be identified, including the transverse cervical artery and suprascapular artery.